Everyone. Today being World Autism Day, the 2nd of April, we have come here to speak about what autism is. Many of you find difficulties in understanding what autism is. Some may underestimate it, but this is one of the most powerful disorders that people are facing today. And today, on the Big Talk Blueprint, I happen to have hosted the president of the Uganda Language Therapists Association, and also he acts as a speech therapist for Smile Train Africa. Is it Smile?
Yeah, Smile Train.
Smile Train
Yeah.
Africa. Okay, Smile Train Africa. He's here. He's Mr. I think I should not introduce him. Let him introduce himself and give us a preamble about what autism is. Yes, sir. You can tell us what autism is
Yeah.
and tell these people who you are.
Yeah, thank you so much, Mr. Raymond, for hosting me today. As he has said, that today is World Autism Awareness Day. That is celebrated across the universe on each second day of April every year. So this year, we also join together to celebrate autism as we embrace autism and also give more clear knowledge and understanding of autism. Before we dive deep into what autism is, I would like to first introduce myself. My name is Kisembo Calvin, as he has said. I'm a speech and language therapist. I am also an autism advocate. I do speech and language therapy for children with autism, and I am also the president of the Uganda Speech and Language Therapist Association. I have had a, a vast number of years of experience in managing autism, and also I've featured in many international conferences that discuss mainly about autism. As he has told me what autism is, I
Yes.
briefly
I
want
would
to
like people to
describe.
know what autism
Yeah.
is.
Briefly, I can just say that autism is a neurodevelopmental disorder
Yes.
that affects individuals in their communication, in their social skills, in their behavior, and also sensory regulation. It means that children with people born with autism or people who have autism,
Yes.
people who have been diagnosed with autism spectrum disorder, experience deficits in their communication development and also in their behavior and social interaction. Not forgetting they're also sometimes affected in their sensory modulation or sensory regulation. Briefly, that is what autism
That is what
is. Yeah.
autism is. For someone who's outside there, for example, a parent, we can have a parent, a caretaker, as you said, it can be diagnosed in children. What are some of those signs that someone or umuntu can see and be like, this child has signs or has autism or has language and so on issues?
Yeah, before we go into that, I would just want to also make it very
Yes.
clear that before we diagnose autism,
Yes.
we first look at what is the typical developmental milestone
Yes.
for all children. Yeah, since I'm a speech and language therapist, I'm going to focus more on the communication bit of it.
Mm.
Yeah, so we would want to know, how do these children evolve? So in typical development, you'd find that a child, when he's about 3 years, they start smiling at a parent or a mother when they are breastfeeding. At around 7 months to 9 months, they began vocalizing or babbling, saying
Yes.
sound which are vowel-like ba ba ba, ta ta
Yes.
ta. And then at about 1 year, at an average of 1 year, a child is able to say a single word.
Yes.
Then at 2 years, a child is able to say two words like
Yes.
"mami mpa,"
Yeah.
"give
Mommy, I
me."
want food.
Exactly, the simple
Mama,
ones.
what? Yeah.
And actually nowadays we see that there is a trend where children actually develop even faster than their age. I
Yeah.
think this is because of exposure and also the environment which has kept on changing with a lot of technology and a lot of play
Yeah.
activities. Yeah. So you find that a child at 3 years, they're able to say 3 words, and at 4 years, they're able to say 4 words. And at 6 years,
Yes.
a child should be able to engage into meaningful conversation with
people.
any other communicating partner. But now you're going to go to a child with autism, who has been diagnosed with autism, or is being affected by autism. You find that all these skills delay to
The
develop.
talking, the bar,
Yeah.
the so on, they do it.
Yeah, you're going to find that some of them actually develop typically up to about 2 to 3 years. Then later you're going to see that this child regresses. The one who knew how to call mommy
Yes.
may not able to call mommy. The one who was able to listen to instructions may not be able to listen to instruction. The one who
It
was able
affects even the hearing.
may not, it doesn't affect the hearing,
Yes.
but it affects the listening. Yeah,
Oh,
because hearing and listening, they are
they are different.
different. Because hearing is just a phenomenon of someone to capture the auditory perception of any sound in the environment. But listening is making meaning of what you've heard. For example, if you call a child by name, maybe
Yes.
Ronnie, the child is able to hear and then comprehend that I've been called, and then I have to respond back.
So that is listening.
That is listening. So you're going to find
Okay.
that these children have deficits in listening as well. So at around 3 years,
Yes.
children may end up regressing even when they had a typical development. So that means that at this age, you're going to be able to diagnose autism.
At
So
3 years, that is the
yeah,
age where autism is diagnosed.
it is not like concrete that at 3 years the autism is
Yes.
diagnosed. Why they say that at that age? Because at 3 years, some of the developmental milestones have already been achieved.
Mm.
So if a child has deficits in achieving those developmental milestones in the areas of behavior, the areas of
Listening.
communication,
Yes.
that encompasses language, that is the expressive language, receptive language,
Yes.
that is understanding, and also expressive language, be able to express yourself or to talk about yourself.
Mm.
So you're going to find that if a child has deficits in those areas of social interaction,
Yes.
of behavior, and communication, as well as sensory regulation, it definitely gives you a clue that this child has autism. However, we as speech therapists do not diagnose autism.
Who diagnoses autism?
We work in hand with the neuropediatricians
Oh.
and also the clinical psychologists who diagnose autism. So after diagnosing autism, they send these children to ask the therapist to work on them. And also on that note, in the multidisciplinary team management of children with autism, we work also with other professionals like the occupational therapist. We also work with the behavioral scientists and also the specialist teachers. We also not forgetting that we also work with parents, especially if we are dealing with children.
Yes.
The parent is the biggest stakeholder because he's the one or she's the one who stays with this child the greatest time of the day.
Now,
So
my question is,
yes.
there's this question whereby we have these people who have like amuntu esikamu kogera. Eh? Like for example, I'm speaking a word. I'm like, for example, I'm saying Mr. Calvin. I say Mr. Calvin.
Okay.
Is that also as a result of autism?
No. That's not a result of autism. That is stammering.
Oh.
Stammering is another, it's a different condition, and we normally refer it to as a fluency disorder. That this stammering affects how you articulate or how you are fluent in your speech. So it makes that your speech may not be intelligible to other communicating partners. Not generally that stammering is caused by autism. It is another condition.
And this
But
brings me to
it is
the
a
question.
fluency. Yeah.
This brings me
disorder.
to the question. Most times we have people saying that still children or people with autism, they are non-verbal. Is it a misconception or it is true?
Yeah, I'm not going to call it a misconception, but I want us to make things very clear.
Yes.
That when children are diagnosed with autism, they experience many things. Some children are non-verbal completely at the time of diagnosis, while others are verbal, but not so. Not that their speech has not yet fully developed at the time of diagnosis. So having autism does not clearly conclude that children with autism are
And
non-verbal, because we have people who are with autism and they are verbal and they use speech to communicate.
Okay.
Yeah, and then we have those one who are not verbal. Because and how do we determine that this person is not verbal? When you look at the typical development of speech
Mm.
and language skills, it starts from the time of birth up to about 6 to 7
Yeah.
years. So
Someone must
beyond,
have
yeah,
gotten full speech.
yeah, beyond that time, if this person has not developed any word,
Yeah.
it is difficult for them to gain that functional speech that can be used for their day-to-day communication. However, when you get some children with autism, even when you do, even after therapeutic interventions,
Yes.
they may uh, they may not reach their verbal communication. But it doesn't mean that a child who is non-verbal does not communicate. What do we look to? We want to look at the child's concentration,
Yes.
because when the child concentrates, they can listen to instructions. You understand?
Yes, I
So when
understand.
they listen to instruction, it means this person is understanding already.
Mm.
This person is understanding. So when someone understands, meaning you can communicate, you can send them and they bring what they want.
Mm.
Or you can use other means of communication. So
So
it doesn't mean that when someone has not developed speech,
yes.
so that is their end of life in terms of communication. No. There are other many means of communication. Speech is just one of them. For example, we have what we call the ASC. ASC is argumentative and alternative communication.
How does that one work?
So why do we say argumentative? Argumentative means supportive, to argument, to support. Then alternative is other means. Apart from speech,
Yes.
we use other means. For example, we can use picture,
Picture communication.
yeah, picture card exchange, picture exchange communication system, where a child may use, for example, a picture of a plate of food.
Yes.
When they are hungry, when they show it to you, definitely you know that this person needs food. Or they can use, you can get a simple picture of a bedroom with a bed,
Yes.
meaning they want to rest. So those are the simple ASC, or what we call alternative and argumentative means of
So
communication.
during setup,
However,
you provide them with those pictures.
maybe just to, before we go there,
Yes.
that however, now when you look at these children using ASC, we also have what we call high tech. You understand?
Mm.
So they were also we call low tech, like using the picture book.
Yes.
So you can design your book having
Many pictures.
many pictures of many activities. That is a very simple one, simple ASC. But also have what we call the high tech, high technology,
How does
where
that one work?
where for example you can use like gadgets like apps on the phone for them to communicate. You understand? So or there are also other gadgets like the hearing aids, you
Oh, I've
know.
seen those ones.
Yeah, so all those one works not only for children with autism, but also children with other communication
Other communication
difficulties.
challenges.
So
So
autism is not a communication difficulty. Autism is a primary condition that makes this person to have deficits in communication.
communication.
But there are many other conditions that can make a person have deficits in communication. So I want to make it clear to our people viewing us
Yes.
today that it is not only autism that causes people to have difficulties in communication or difficulties in their speech and their language skills. Autism is just one of them. But today, as we celebrate World Autism Awareness Day, we want to discuss issues about autism, especially now we have done the introduction,
Yes.
and then we want to see really that this
People have
day
understood what
people can
autism is now.
understand what autism is, what are the available interventions. Because having a child diagnosed with autism does not mean that that is the end of
That's the
this
end of the
person.
child.
There are many interventions that we can really engage in, which can support these children and develop better with better communication skills.
Now, Mr. President,
Yes.
I know there's someone who might be confused as me
Yeah.
at this point outside there, like asking, what is this? Does this autism go on like what are its further effects if not attended to? Because someone might be having a child with autism, and maybe they are unaware, but now they have known. What are some of those future problems that this child is to face if unattended to? if this autism is not attended to in the early journey, in the early stages?
Early intervention.
Yes.
Early intervention comes with early identification, early diagnosis, and early intervention. So when you realize that your child has one of those signs that I've just explained
Mm.
previously, you are advised to seek medical attention. Go and get a diagnosis or talk to your therapist. You understand?
Yeah.
Talk to your therapist, then you start early intervention. Why? What do we understand by early intervention? It is when we start these therapies
Early.
at an age that is early, because age is one of the factors that affect.
Autism.
That affect. Let me say recovery. For example, when
Oh.
you start early, that means you have better chances of this person recovering other than starting at an early at later age. I just explained to you that it has been proved scientifically that development of communication takes up to about 6 to 7
Yes.
years. So meaning when you delay to start your intervention within this age where the brain is still neuroplastic, there's also what we call neuroplasticity of the brain. It means that the brain is still young and can be adjusted
Yes.
for it to learn during these early stages of life. So when you exceed these stages of life, it doesn't mean that your child or your person may not recover or may not gain any skill, but you would have reduced the chances of this person to be better or to gain these skills more faster than for you starting intervention past time.
And now, where I come in, I know there are people who may be old, around 20, around 30, 40, and asking themselves, is autism also affecting us? And what are some of those things we can see and be like, this person is having. My brother is 20, my sister is 30, and they are having autism. What are some of those signs that I can see and be like, bro, you're having autism? Yeah.
Yeah, of course. Thank you so much for that question. And sometimes, of course, we know that people take time,
Yes.
and also people do not know. People are ignorant
Yes, people
about
are
these
ignorant.
conditions. Yeah, there are some people believe that these conditions because of witchcraft.
Yeah.
They also maybe the
Some of them think
family.
it's a family trait.
Yeah.
Yeah.
But I would like to make it very clear that when autism is not diagnosed in the early stages,
Yes.
thereafter it will not be managed in the early stages. Of course, this autism does not go away.
It
Autism is
remains.
a neurodevelopmental condition, meaning it's developing with the brain development. As the brain is developing, it's developing along. So it doesn't mean that when you're 20 years, autism is going to run away.
It's going to remain.
But what can run away are these deficits. For example, the undesired behavior, and restrictive
Yes.
behaviors, and also the poor social interaction, and also the poor communication. So when we start intervention early, these signs can actually be outgrown. All these presentations can be outgrown, and this person can have better life. How? Because they can communicate better, they can also behave better in the society, they can also interact better in the society. So it means that early intervention is very crucial. And also, if you didn't have chance to diagnose autism at an early age, of course, even some of these interventions are very new.
Yes.
Like speech therapy, it has been in this country for over 18 years. So there are those people who are more than 18 years, who have been living with autism.
That's why I asked you that question. So I have a sister who is actually.
Yeah. So I would like to inform the public that at any age we start intervention, but this intervention is different. Also, depending on what age you start the intervention from. So, meaning if this person is older, what do? You want to first identify which are the challenges this person have. So when you identify the challenges, for example, if this person have difficulties understanding instructions,
Yes.
you understand, or difficulty expressing his needs. So
Just outline for them like 3 signs that someone like Raymond, I can be there and I be like, yes, this brother of mine is having autism. Like 3 signs that are physical.
As I told you that the physical signs or in a diagnostic criteria of autism,
Yes.
this person will have one difficult deficits in behavior,
Yes.
meaning they behave undesired, like their behavior is not like that one that desired in the society. One, you find that they are very aggressive, they are very aggressive,
Yes.
they have stereotypes, repetitive behavior, you understand,
Yes.
that is not really desirable in the society, in the community. So another thing also, you find that they have deficit in social interaction. They always want to play alone. They don't want to engage with other people, you understand.
Yes.
Then with communication, you find that they have difficulties in communication. One, their language is not developed well, or it delays to develop. And also you're going to find that their expression of needs, instead of maybe asking you or what they want, they will maybe grab from you or from the fellow people, which is not really desirable in society, you understand. So those are, and also you find that some of these people have sensory behaviors. For example, they have poor sense of touch,
Yes.
or sometimes it can be hyper or hypo. Hyper means so high that when you just tap them like this, the pressure that you just touch like this, it makes the pressure is enough to cause pain to them.
Oh.
So it means that their brain responds so much to the sense of touch. There are those who are hypo, you understand, meaning that they have low sense of touch. They call it low tactile, like tactile is touch, you understand. So you're going to find that this person who has low sense of touch, they're going to have deficit. For example, you find that they start biting themselves, you understand, hurting them, because for the pressure that should be exerted on their body for them to cause pain is too much pressure. So they find that they are hurting themselves, throwing themselves down, you understand.
Yeah.
So those are some of the, of course there are many other signs, but those are some of the things that you can identify very quickly, and you seek professional advice. Yeah.
Yeah, I know. People have now understood what autism is, some of the early signs and the late signs of autism.
Yes.
And we have had challenges of people accessing speech therapists. Since people have now known, people accessing speech therapists, and then family intervention. What are some of those systems that you, as the president of the Uganda Speech and Language Therapists Association, have put in place to make sure that families can intervene in this, and for example, like a system you've developed to ease the treatment or the therapy of these people who are suffering from language therapy?
Yeah, I want to be very sincere to you. There are many interventions, especially in the area of speech and language therapy. We do intervention for children with autism.
Yes.
And when a child is diagnosed, we encourage to start therapy immediately. So, like your question, what have we put in place to support
ensure that
parents and families, men and children of these challenges will access it? One, at this time, most of our interventions are private. They are private in schools.
Yes.
There are those schools which really take in children with autism, but having speech therapists. We normally call them inclusive schools.
Yes.
Yeah, they have therapy intervention for children with autism. So it doesn't mean that when your child has autism, you should keep them at home. No. Why do I talk about schools first? Because most of these children, they have to be in school because their age requires them to be in school. So, but you'd find that not all schools can manage these children.
You find schools suspending them, telling their parents.
There are schools that are called inclusive schools. They are around here in Uganda, especially in the urban areas.
You can give an example too.
For example, we have Talema Inclusive Junior School that is in Maya along Masaka Road.
Yes.
That takes in children with autism. Then we have many other schools that we can also identify. Then we have also centers, rehabilitation centers, where these children access these services. And also nowadays we also have hospitals who are really having therapists that intervene for these therapists. However, we have a biggest challenge.
What is that big challenge?
The biggest challenge that in our public health system, for example, what I mean, the public hospitals,
the government.
At this time, as we speak now, we have only one speech therapist that is under the public health system, or who is working at a government hospital.
That is a big
and
problem.
That is only at Masaka Regional Referral Hospital. So when you look at the current population census for Uganda, it gives about 13.5% of people living with disability in Uganda.
That's a big
That is
percentage.
numbering up to about 5.5 million people living with disability. So when you look at the ratio of speech therapy to people living with disability, you're going to find that this ratio is too high.
Yeah.
So what does it call? It calls that government has really to support therapists in their work. For example, by recruiting therapists, at least in the regional referral hospitals,
Yes.
such that in the region,
To the level of even health, health center to reach.
yeah, because when you look at now, these therapy interventions are localized in urban areas.
Yes.
For example, in Kampala here, there are people trying, like there are therapists who are on a station in Kampala. But when you go to Mbale, you go to Kapchorwa, you go to Kotido, you go to Arua, you go to Kisoro, all the regions of in Uganda, which are not in the urban areas, do not have speech and language therapists. It makes it very difficult for parents or for caretakers, people who are living these children with autism, to access these interventions. So we like really to encourage the government to really consider recruiting speech therapists in their hospitals, such that these people who are having these challenges may access the services.
What are some of those sensitization systems you're putting in place? Are we having reach outs for autism? Are we having I can for example, to sensitize those systems you're putting in place to sensitize people about autism, that people can get aware that yes, this autism exists. It is not a chintunti, it follows from the bloodline, or it is a dogo or witchcraft. What are some of those systems?
So the system that we have put for sensitizing, one is this one.
Yes.
And I would like to appreciate you really for broadcasting us on your platform, because through these platforms, many people who are online, because nowadays you have many people are online.
Yeah, we have many people.
They can really act. So we are empowered. We are using all the available resources. For example, we are using the online platforms to really echo out what autism is, what are the available interventions. Maybe as an association of speech and language therapists in Uganda, we also are planning to organize conferences.
Yes.
Like this year, we have a conference, a scientific conference in December, but in November. It is a general conference which will be talking about communication difficulties. Yeah, so we shall release the official announcement about this conference.
Yes.
And also in May 7th,
yes,
we are going to be involved in a camp in Lweza.
You're going to have a reach out.
We are going to have an outreach camp in Lweza that is going to provide free assessment to all people with all difficulties, including autism. And also May 18th is the National Day of Speech and Language Therapy. So we have also put this day as a day of creating awareness, and also a day of reaching out to the community with free services, and also advocating it to the grassroots. So 18th, come 18th May, we are going to have an outreach. At this time, we are planning if it will be either at Mulago Regional Referral Hospital or Kampala School of the Handicapped. So we want to really encourage people to bring.
Mr. Calvin, you as the president of this Language Therapist Association, I know you have faced a lot of challenges in this autism giving services. What are those challenges that you can outline? I want you to be a little bit brief in outlining these challenges that you're facing as people who are delivering these services of therapy.
Yeah, to start on, I would like to say that one of the challenges that we have is lack of low awareness. That few people knows about these challenges, and you're going to find that people are there in the communities and they don't have any solution because they do not know that there is a solution. Then the other thing is also we have few therapists. Yeah, so there are few therapists, and because we have few therapists, meaning it will also lowers the accessibility of our services to the community. Then the other challenge we have that we have a a very big challenge that called myths and misconceptions.
Yes.
Yeah, there are many people who believe that autism is they have been bewitched,
Yes.
or maybe it is from a family line.
Yes.
You find that one parent is blaming the other.
Yes.
So in the long run, because of these myths and misconceptions, they take long to accept. And when they take long to accept, meaning the child is going to delay to get these interventions. Yeah, so and then the other thing that we have had a long time, we have been advocating that the government takes in speech and language therapists at these regional referral hospitals and also the district hospitals, such that we can increase accessibility of these services even in the rural areas, because this problem does not only manifest in urban centers, it's also there in the rural areas. So we have the government is taking long to really appreciate or to recruit speech and language therapists, and would like to really encourage them that speech therapy works, and also children with disability deserve the best. They deserve this intervention. Yeah.
This brings me to the question. We're having a lot of students who have finished Form 6. A language and speech therapy, I know, is a growing field in the medical section. What are those requirements for students who is out there and who has finished Form 6 and may have picked interest in language and speech therapy? What are the requirements for them to study speech and language therapy?
Yeah, so the entry level for speech and language therapy study in Uganda is bachelor's degree. So speech and language therapy, by the way, it is a science and health-based program.
Yes.
Yeah, so when you come in, we have what we call direct entry. Those who come directly from high school or from A level. So you're required to have your essential subjects are biology and chemistry, then the relevant either physics, mathematics, or agriculture.
Okay.
So if you have those combinations, like which have biology, chemistry as the
majors,
the majors, then the relevant subject can be either mathematics, agriculture, or physics. So that is the direct entry. Then we have the mature age,
yes,
or the diploma scheme. So if you've done any health related course,
someone who has a certificate in nursing, midwifery,
a diploma,
they can go for speech therapy.
If you have a diploma in nursing, diploma in clinical medicine, diploma in any health related program, you can enroll for speech and language therapy. And currently this program is being taught at Makerere University,
only
College of Health Sciences in Uganda.
Only.
Yeah, only.
Okay, this is a hot field, guys. We're having scarcity of language and speech therapists, as you've heard. Mr. Calvin, before we close this, I want you to give a message to families and people there on how they can handle, all the community, on how they can handle these people who are living with autism, not to segregate them, but to understand them and absorb them in the community and accept that autism is a problem that is being faced in community, and we have to embrace therapy for it.
Yeah, this year, the World Health Organization, the theme for celebrating autism 2026 is autism and humanity.
Yes.
So it means that people who live with autism, their lives also matter.
Yes.
They are like us. Of course, they might have challenges in their development. It does not make them inhuman. They are human like us.
Yes.
So I would like to encourage all people, not only those who are nurturing children with autism, but all people in society.
Yes.
Let us embrace autism. Let us accept it. When we accept it, let us explore the available interventions, because with therapy, with intervention, these people can actually gain skills that can make them better. Actually, I would like to let you know that we have many success stories, because me, I've worked with children with autism for now 6 years, and I've registered a lot of success stories. There are children whom I started working with and they were non-verbal. Now they are verbal, they are in school, and they are very, very brilliant. So when your child is diagnosed with autism there, I would like to encourage you, please don't shy away. Don't hide your child. Bring your child for therapy, for speech therapy, for occupational therapy, for special needs education, and also for behavior management. This child will actually grow and also develop skills like any other person. Yeah, so like any other disability, children with autism need extra support. and therefore let us support them. Before I conclude, I would like to encourage, like, if you're a Christian, I'd like us to remember even this World Autism Awareness Day comes just a day before we enter into the Easter season. Let us remember that even Jesus Christ embraced disability. He did not chase people who were lame, people who were paralyzed, but he healed them. After healing them, he wanted them to come and live together with their society. So let us, all of us, embrace autism and also know that people who are living with autism are also human, and therefore they deserve the same treatment like any other person. So when we do that, we shall be champions, and therefore we shall create a suitable environment where these children with autism can also access all the needs in the society, and they can also participate fully in their day-to-day activities in the society. Thank
Mr.
you.
Calvin, before we conclude, because I hope to host you here back very soon. That's probably next you said May 18th. After May 18th, probably I'll have to host you on 19th to have another speech. But I want you to give one last word to these people who are living with autism. Give them a word of hope, and someone today who is willing or who's watching this show and is willing to support people who are suffering with autism, or reach out to the association of the autism and the speech therapists. How can they reach out to you, Mr. Calvin? Because I know there are people with those good hearts and they're willing to support.
One, we have a website that is Uganda Speech and Language Therapy Association, abbreviated as USALTA.
Yes.
USALTA. Yes. Yeah. So when you reach at that website, it will take you to where you can put in your contacts and your and your concern, and then after your message are read and you give an intervention.
Okay.
Like here in Kampala, we have also free services for these children with disability. For example, at Mulago Regional Referral Hospital, it is a training hospital for speech therapists. Therefore, there is a clinic that runs there at Mulago.
Yes.
New Mulago, there is a clinic for speech therapy. Yeah, so because it's a training hospital, therefore they have a clinic for speech therapy. And also, apart from being a president, I'm also running a foundation that is called Talemwa Foundation and Child Development Center.
Yes.
We want to develop this foundation into a hub where children with disabilities, including with autism, can have accessibility to services with subsidized prices. Yes. Because now we know that therapy is quite expensive sometimes to parents.
Yes.
But we want to encourage that. I want to develop this foundation. It is attached to a school that I told you, it is Tarema Inclusive Junior School. Inclusive means that it is taking people with autism, those other form of disability, but also autism inclusive. So these are something that we want to explore.
But how can someone reach out to help? Someone can have their support financially and wants to support people who are suffering from autism. How can they reach out with their support?
So they can reach out directly to me.
Yes.
That is one, through my contacts.
I'll be putting your contact and your name on these videos.
Yeah, exactly. So people can access them. Can access me through those contacts, and also I say through the association website. So when you reach on that website, you can ask whether you want to have private therapy or you want to get the free therapy from the clinic at Mulago Regional National Referral Hospital, the training clinic of speech and language therapy. So you can reach the website, or you can also reach out to me directly. My contacts will be displayed, as he said.
Yeah, and I'll even put the description of the website in the comment section.
Exactly, and we shall be very grateful to really support you and to work together. Thank you so much.
Yeah, and that has been Mr. Calvin Kisembo, the president of the Autism and Language Therapists in Uganda. Yeah, Mr. Calvin, thank you so much. I hope to have you here soon. And if you are going to have many questions, drop them in the comment section. He'll be here another time to answer more questions about autism. This is just an awareness, but we shall be here for more.
Thank you so much, and have a blessed day.
Yeah.